Here we'll talk about RMNCH+A strategy. So it is a heart of National Health Mission. It is launched in February 2013. It is based on the provision of comprehensive healthcare to the 5 pillars. So what do you mean by comprehensive healthcare? It includes preventive, promotive and the curative medicine. So through this strategy, we are trying to give this comprehensive care through the 5 pillars, which is based on this reproduction, maternal, neonatal, child and the adolescent health. And this plus sign which is there, so RMNCH plus, so this plus indicate 4 things. So this adolescent life stage is being identified as a life stage for the first time, right? So adolescent as a distinctive life stage being identified and added in this strategy for the first time. And also it links this home and the community based services to facility care. So we are linking this home and the community to the facility care. So in this RMNCH+A, you are linking this maternal and the child health care to this reproductive and the adolescent health. And the next point is it ensures referrals among this PHC, CHCs and the district hospitals. So we are referring to the PHC, CHCs and the district hospitals. So this is about the plus sign. It indicates 4 things. One is about the adolescent, and then you are connecting this reproductive and the adolescent health along with this maternal and the child health. You're also connecting this home-based and the community-based programs to the facility health. And you're also ensuring this referrals to the PHC, CSS and the district hospital. So this is what this plus indicates. Now let us see this aim of this RMNCH+A program. So it has many things, right? RMNCH+A. So just remember, it is trying to reach this maximum number of people. We are trying to reach as many people as possible who are present in the remotest areas of the country through the services, innovations, monitoring of the interventions and all. Right? So let us see the goals. So it has 3 goals. One is to reduce this infant mortality rate 25 by 1000 live births by 2017, and also to decrease this maternal mortality rate 100 by 1 lakh live births by 2017, and decrease this total fertility rate to 2.1 by 2017. Right? So this program is launched in 2013. So the goals were also up to 2017. So what are the goals? Infant mortality rate should be reduced to 25 by 1000 births, and maternal mortality 100 by 1 lakh births, and TFR should be equal to 2.1. So these are the goals of RMNCH+A program. I want you to remember these targets according to the different pillars of this program, right? So this R stands for reproduction. So even in the target, just remember we are trying to mainly focus on this family planning programs and all, right? So decrease the unmet needs of family planning and increase the met needs of this modern family planning methods. So that is about R. And then let us see about this M. So in the M stands for maternal health. So we are increasing this delivery points. We are increasing the proportion of the pregnant women receiving antenatal care, checkups and all. Increasing the proportion of delivery by the birth attendant, skilled birth attendant. Increasing the proportion of institutional deliveries. Increasing the proportion of females, pregnant females and the newborn receiving this postnatal care. So what are we doing under here? ANC, PNC, institutional deliveries with the help of skilled birth attendant. So this is being done under maternal health. Now let us see about this neonatal and the child health. So we are increasing this exclusive breastfeeding rates, and we are also increasing the use of ORS in the under 5 children with diarrhea, and increasing the coverage of this immunization of the vaccine, DPT vaccine, right? So 3 doses should be conducted. We are increasing the coverage of DPT vaccine, and decreasing the prevalence of under 5 children who are underweight, and increasing the sex ratio of 0 to 6 years age. See, let us see what is happening here. First, we are promoting this breastfeeding. So in the neonatal, just remember, we obviously will talk about breastfeeding and all. And in the under 5 children, what are you trying to do? We are trying to decrease the diarrhea, and also we are trying to decrease this underweight cases. So write about this child, under 5 child, you are using this ORS and also decreasing this underweight of this under 5 cases. And also in the child, just write about this, we are trying to increase the sex ratio of age 0 to 6 years. And then the last point, write about this immunization. Wherever the child comes, the immunization comes in SPM, right? So we are trying to cover this 3 doses of DPT by this program. So what happens in the adolescent age group? 1, there can be anemia, and 2nd, there can be conception, pregnancy, right? So we are trying to decrease anemia in the adolescent girls and boys, and also we are trying to decrease the proportion of total fertility contributed by adolescents by providing them condoms, OCPs and all. So here we'll talk about this 5 into 5 strategy of RMNCH+A program. So in the reproductive health, you have to remember this family planning programs. In the maternal health, you have to talk about pregnancy. In the newborn and child, obviously you'll talk about the health of the child and the newborn. And in the adolescents, we'll talk about two things. One is about this anemia, menstruation and all. And second, it is about the sex, right? So in the reproductive health, we'll talk about this family planning programs. We'll provide them PP IUCDs like postpartum IUCDs at the intervals, and also contraceptives, pregnancy kits and the sterilization. So we are providing space methods by postpartum IUCDs. So after the delivery, we are installing this IUCDs in the woman, that is postpartum IUCDs. And also IUCDs can also be installed at any time. So interval IUCDs at the facilities is also being provided. Whenever the woman comes to the facility and wants to have the family planning and all, then we can administer this IUCDs at the intervals, right? And also home delivery of this contraceptions by the ASHA, and NISHCH+A pregnancy kits are also being provided. Quality sterilization services are also being done. So whenever they come for sterilization, we are providing this quality sterilization services. So that was about reproductive health. Now coming to the maternal health, you'll have to remember all about the pregnancy, right? So first we'll register the pregnancy, and then we'll detect if there is any high risk pregnancies and all. Then we'll have this highly trained HR for delivery, and review the maternal and infant death. If there is any deaths happening in the community, you'll review the death. So through that, you'll know what is the problem happening in them, right? And then we are providing this misoprostol in the 8th month of pregnancy. So these are the two drugs which are being provided. Remember, one is a misoprostol, which is being provided in the 8th month of pregnancy, and the gentamicin is given for newborn health, right? So in the newborn health, you'll write all about this newborn care, right? So different types of newborn care, like home-based newborn care, essential newborn care, special newborn care, and obviously in the newborn babies, you'll promote this exclusive breastfeeding, right? So this is about newborn health. And whereas in the child health, you'll write about different types of diseases like diarrhea, pneumonia and all. And then you'll do the full immunization and all. And also in the RBSK, you'll have 4 different types of Ds, right? Defects, disabilities and all. So just write about all the different types of diseases in the child health. In the newborn health, you'll write about this newborn care, different types of newborn care like home-based, essential, special newborn care. Whereas in the child health, you'll write about different types of diseases like pneumonia, diarrhea, full immunization, RBSK program and all. And also along with all of this, you are providing iron and folic acid supplementation. Whereas in the newborn, you are providing breastfeeding. In case of child health, you'll provide iron and the folic acid supplementation. So now let us talk about this adolescent health. As I said, you have to remember 2 things in the adolescent health. One is about this anemia, menstruation, and second is about the sex, right? So one, anemia, we are giving iron and folic acid for the anemia, and also we are teaching them this menstrual hygiene and all. And then RMNCH clinics are being conducted, like adolescent reproductive and the sexual health clinics are being given, and increased contraceptive prevalence, right? So contraceptive prevalence, we are also increasing this contraceptive prevalence. And health education, peer education, community-based services through the peer education are being conducted. So this is about 5 into 5 strategy. So just to summarize, in the reproductive health, we are talking about this family planning. One is through the contraception, other is to IUCDs, and third is to the sterilization. In between, you'll also provide this NISHCH+A pregnancy kits and all, right? Second is about maternal health, where you'll talk about the pregnancies. So first we'll register the pregnancy, we'll detect if there is any high risk pregnancies, and for the delivery, we'll provide them one trained HR. And if there is any death of the mother or the child, we'll review that. And also misoprostol is being given under this maternal health, and also under this newborn health, you're giving gentamicin, right? So in the newborn health, you'll write about all this newborn care like home-based care, essential newborn care, special newborn care and all. And then you'll write about this breastfeeding. In case of this child health, you'll write about all the different diseases like diarrhea, pneumonia, full immunization, RBSK program. And then you'll write about this iron folic acid supplementation. And in the adolescent health, you'll write about anemia, menstruation, RMNCH clinics, contraceptive prevalence, and the health education, right? So this is about it. Bye.